The passing of Dangal actor Suhani Bhatnagar due to dermatomyositis has brought attention to lesser known risks of this disease as it is not typically considered fatal. Dermatomyositis is a rare autoimmune disease affecting both the skin and muscles, characterized by inflammation leading to muscle weakness and skin rashes. Experts told News 18 that it is a rare disease occurring in just 2 to 3 people for every 1 lakh population. One of the hallmark symptoms of dermatomyositis is distinctive skin rash. This rash often appears on the face, eyelids, knuckles, elbows, knees, chest and back. It may be reddish or purple and is often described as heliotrope rash. The disease is becoming common among youngsters and children, but earlier its onset was seen among people in their 40s or later age group. While management of this disease is slightly difficult among children, a very well-disciplined life along with regular blood tests and anti-inflammatory diet helps people live a long life. Now let's discuss how the body develops this disease. The exact cause of dermatomyositis is unknown, but it may be due to a viral infection of muscles, mostly due to a problem with the body's immune system when the system mistakenly attacks its own muscles and skin tissues. Other causes could be bacterial infections and genetic and environmental factors, including ultraviolet radiation exposure and air pollution. It can sometimes be caused by drugs like statins, which are used to reduce cholesterol. The disease can be malignant in about 30 to 40% of patients, and people need to be concerned if they notice extreme weight loss. It's very important to spot symptoms at the right time. Doctors told us that muscle weakness and rashes are two top symptoms of dermatomyositis. It typically affects the muscles closest to the trunk of the body, such as those in the hips, thighs, shoulders, upper arms and neck. Weakness may make it difficult to perform everyday activities like climbing stairs, standing from a seated position, lifting objects or reaching overhead. In fact, the affected person finds it difficult to raise the arms above the shoulder level and also to get up from a sitting position on a chair or the floor. People experience profound fatigue that is not relieved by rest, and this fatigue can significantly impact daily functioning and quality of life. In addition, a low-grade fever may accompany the onset or flare-ups of dermatomyositis. How can it be treated? Treatment typically involves medications to suppress the immune system's abnormal activity, such as steroids or immunosuppressants. Physical therapy and exercise are often recommended to help maintain muscle strength and function.
Dermatomyositis is definitely on the rise as per the global trends. It's an autoimmune muscular disorder which comes along with muscle weakness and a characteristic skin rash. So yes, we should not ignore a skin rash which comes along with muscle weakness. Most importantly, it also used to earlier affect only people in their 40s and 60s, but now it's also affecting children. Most common reason for dermatomyositis is of course genetic for this autoimmune disorder, but also certain viral influences which have triggered this disease. Besides that, environmental triggers, chemicals, stress, etc., which can definitely lead to this kind of a disease. There is an increase in CK, creatine kinase, an enzyme which gets released in the body. ESR will also be raised for people with dermatomyositis. In certain lucky cases, dermatomyositis could be self-limiting, with which I mean it can resolve on its own over a period of 4 to 5 years, as has been seen. But in few cases, this can actually lead to death. Always remember, dermatomyositis itself will not cause death, but dermatomyositis can lead to, number one, higher chances of internal malignancies. A lot of cancers in the body whose incidence is seen to double, triple for people with dermatomyositis. Besides that, with over a period of time, lung myositis, where the lung becomes so weak that the muscles of the lung are unable to breathe properly. This is of course triggered in cities where there is high pollution, like ours in India, and particularly in Delhi. So people of dermatomyositis need to stay very diligent, very disciplined, especially regarding their hygiene, regarding their health, regarding their lifestyle, regarding their diet.
Dermatologists and rheumatologists and other experts told News 18 that the disease proves fatal when it affects crucial organs like lungs, heart, or respiratory system. Doctors told us that death generally does not happen because of dermatomyositis but due to the complications led by dermatomyositis, which can be due to lung myositis when a person is unable to breathe. Also, the disease increases the risk of developing cancer. The survival rates of patients depend on early diagnosis. Effective treatment significantly improves the chances of survival and healthy long life.